So with that, I'd be glad to move the bill.
Any other questions or comments from any of the other members? Do we have a motion? We have a motion by Senator Wolk. I have a couple comments. When I was briefed, I know and understand that a lot of the issues at hand, especially dealing with the incompatibility of the internet base, could be addressed or should be addressed in judiciary. This is the Health Committee. I am going to support the bill, but obviously I am in favor of licensing, transparency, and notice, is what Senator Wolk said. But I'd like to reemphasize with the author, I have some concerns about the incompatibility with the internet-based company. And I really believe that that needs to be addressed and should be addressed in the next hearing, because that's where business is going to. And it's going to make it very difficult for a company that's doing business legitimately to be able to do business here in the state of California. So I'm assuming that the author is going to work with not the opposition, but to hopefully get them off the bill and be supportive of the bill. So I'm assuming you're going to work with the,
Yes, we have a week to work with before we go to judiciary. The biggest issue is that privacy component, because you saw the difference between a referral and placement agencies. So we want to make sure that there's been abuses where they, instead of sending an email to 1 or 3 locations or whatever, they send it to 20, and then you get all these people calling them and talking to some of the families. They get a little bit overwhelmed, and they don't know who their information went to. Right, so
and tours,
make sure we protect them.
And tours, if we're on the other side of the country, we can't fly to give them a tour.
And so, like
well,
I said,
that's already been taken out of the bill. So it's been, we took that out of the bill, it's stricken out, so
Okay, thank you.
we took some of that.
it's in the mock-up. So you have a commitment from the author to work with you. Seeing no other questions, so would you like to close?
Mr. Chair, respectfully ask for your aye vote.
Thank you. This is item number 13, due pass as amended to judiciary. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Wynn. Wynn. Wynn, no. Hall. Mitchell. Mitchell, aye. Monning. Monning, aye. Nielsen. Nielsen, no. Pan. Roth. Roth, aye. Wolk. Wolk, aye. 5-2 right now.
Currently has
Thank you.
5.
Thank you
Thank
for your
you. Currently has 5. It's enough to get out. We'll place that bill on call. We're at item number 14, SB 792 Mendoza, daycare facilities, immunizations, exemptions. Please proceed.
Thank you, Mr. Chair, Senators. I'm here to present SB 792. This is the other vaccine bill, but not as controversial. SB 792 protects young and vulnerable children from making sure that those who care for them in child care settings are vaccinated against serious contagious illnesses. While diseases like the flu seem like a minor inconvenience for you and I, it can be deadly for young children. Last year in the United States, 20,000 children under the age of 5 were hospitalized with the flu, and 100 of those children passed away. Numerous expert bodies, including the CDC and California Department of Public Health, recommend that those who care for young children receive an annual flu shot and other important immunizations. Until they are fully vaccinated, children rely on those around them to maintain community immunity. This bill will affect employees at daycare centers and family daycare homes, and was carefully crafted to place these requirements within existing laws governing daycare centers. All vaccines required by this bill are covered in full at no cost by the insurance policies. Uninsured employees can find no to low cost vaccination at their local health departments. Employees can obtain a medical exemption from their physician if they cannot be vaccinated or if they can show that they already been immune or vaccinated. We work to make sure that this bill is minimally burdensome to providers, which are often small businesses. The immunization records will be reviewed during regular licensing inspections along with other required records such as tuberculosis screening results. This bill will protect children who are too young to be vaccinated. With me today to testify is Erica Pan, is a doctor, and she's a director from the Division of Communicable Diseases and Control and Prevention and Deputy Health Officer for the Alameda County Public Health Department. And a pediatric infectious disease specialist. We also have Amy Alfieri, a parent from Yolo County, and Arlene Garcia, from the Center Director of the Vintage Kinder Care in Sacramento.
Thank you. We have support on both sides. If you please proceed, state your name.
Good afternoon. My name is Dr. Erica Pon, and as mentioned, I'm a local deputy health officer who oversees communicable diseases. I'm also a clinical professor at UCSF in pediatric infectious diseases, and I'm a parent. Today, I am here to represent the Health Officers Association of California. Requiring immunizations for our vulnerable children and the people that take care of them makes sense. Healthcare employers have been requiring key immunizations for healthcare workers, but this has not been the practice for childcare personnel. Infants and young children are at the highest risk for severe vaccine-preventable diseases. We've had two recent large epidemics of whooping cough in California in the last few years, 2010 and 2014. Last year, we had over 11,000 cases of pertussis reported in California and 400 hospitalizations. Over half of those hospitalizations were infants less than 4 months of age. Since 1998, 53 infants less than 4 months of age have died of pertussis in California. Children less than 5 are at highest risk of severe flu complications as well. Here in California, 145 flu deaths in children have occurred since 2004. Since 2009, over 900 children have been in the intensive care unit with flu in California. One of our most infectious vaccine-preventable diseases is measles. As you may know, we had a recent large outbreak of 134 cases in California, and 1/5 of those were hospitalized. And 1 in 1,000 cases of measles will actually die or have brain infections. It's also very important to realize and know that people can pass on these infections to others before they even have symptoms. I've also taken care of many ill children intubated in the ICU, and watching these children and their families suffer from a preventable disease is heartbreaking. Vaccines are safe and effective. Specifically, flu vaccine is recommended for everyone 6 months of age and older. Yet only about half of people get vaccinated every year. I also really want to make sure that all of you know from an infectious disease professional that flu vaccine may cause mild flu-like side effects, but is absolutely safe and does not cause the flu. We've shown with healthcare workers that requiring important vaccinations is needed in order to adequately protect people and have community immunity. In our county, when we required locally for acute care facilities and healthcare workers to get flu vaccination, we increased our numbers from 70% vaccinated to over 90%. During our recent measles outbreak investigations, many people asked and were surprised to learn that there are no vaccination requirements for childcare personnel. I urge you to support this bill and take steps to protect our young, vulnerable children and from vaccine-preventable diseases and our community. Thank you.
Thank you. Please proceed.
Good afternoon, Mr. Chairman and Senators. My name is Amy Alfieri, and I'm sorry, can't read with the glasses and the mic. My name is Amy Alfieri, and I'm a mother from West Sacramento. I'm also a parent volunteer with Vaccinate California. In 2013, when I was pregnant with my second child, vaccine-preventable diseases were definitely on my mind. At the urging of my OBGYN, I had my flu shot and my pertussis booster while pregnant. I studied all of the CDC recommendations, and I encouraged my mother to get her flu shot and pertussis booster as well, since she would be in close contact with our baby. My husband also made sure that he was up to date on his vaccinations before our baby's birth. This is a strategy known as cocooning, ensuring that all people in close contact with a vulnerable infant are fully up to date on their vaccinations. My baby girl was born in February 2014, at the height of the flu season. I kept her at home most of the time, but she often rode with me when I was dropping off my older son at daycare. I worried about bringing my baby along since I wasn't sure about the vaccination status of the daycare provider and her staff, or the vaccination status of the infants and children at the daycare. In my community, moms are deeply concerned about vaccine-preventable illnesses returning to our schools and daycares. We often discuss this in our walking groups, at playdates, and on social media. This past winter, during the Disneyland measles outbreak, moms in my social circles were extremely upset. One mom of an infant and a toddler wrote to us on Facebook that she could not attend a Valentine's Day playdate with us unless she knew that all the other children attending had been vaccinated. This mom was limiting her activities at the recommendation of her pediatrician. Another mom told me of a small pertussis outbreak at a local in-home daycare. 2 infants under the age of 1 were diagnosed with pertussis, and the daycare provider, who had not received a pertussis booster in 13 years, was also treated. Around the same time, another friend received an automated phone call from her daughter's elementary school notifying her of confirmed cases of pertussis at the school. This happened only 2 months ago in February 2015 in West Sacramento, my hometown. It is reasonable, prudent, and fair to require that daycare workers in close contact with infants, children, and pregnant women at pickup and drop-off of older siblings be fully vaccinated in accordance with CDC recommendations. Indeed, I am very surprised that this is not already required by state law. I am sure that many parents would be shocked too. After all, there are many other requirements for preschool teachers and daycare providers who are in close contact with children every day. When I was a public high school teacher, I had to be fingerprinted before I could work in a California classroom. I have undergone background checks and drug screenings for various other jobs. None of these requirements seemed onerous to me, nor did they cause me any undue burden. Vaccines are readily available for free at our departments of public health. They can also be received at a doctor's office, at a community clinic, or at a local pharmacy. During my pregnancy in 2013, I received my flu shot and my Tdap, which includes pertussis, at the local Target store. It was very easy and the cost was negligible. Please pass this important bill to protect infants and children from vaccine-preventable diseases. This is about reducing risk and taking sensible, appropriate precautions to protect vulnerable infants and children. We must keep infants and children safe and healthy in the places where they spend the most time outside of their homes and in close contact with other children. Thank you.
Thank you. Any other support? We have just under 2 minutes left for the proponents. Just give you a heads up.
Chair Hernandez and members of the Senate Health Committee, my name is Arlene Garcia, and I'm the Center Director of Vintage Park KinderCare in Sacramento. Thank you for the opportunity to come before you today on behalf of Knowledge Universe in support of Senate Bill 792. KinderCare is a brand of Knowledge Universe which has been serving families and children for the last 40 years. Our other brands include CCLC, Children's Creative Learning Centers, and an employee-sponsored child development center, and Champions, our programs for before, after-school program, and summer learning. We offer high-quality early childhood education and care at 181 community bases across the state of California and employ more than 3,700 teachers and staff. As well as you are well aware, the U.S. is experiencing a multi-state outbreak of measles, with 178 cases documented between January 1st and March 27th this year. Infants who are too young to receive their first MMR vaccination are especially vulnerable to contracting measles. At one child care center alone this year, 12 infants became sick with the measles, as this highly contagious disease and illness spread from one infant to all others in the center. Given the close contact between child and caregiver and the vulnerable population child care providers serve, it seems prudent that child care workers be immunized, much like our counterparts in healthcare who work in close contact with vulnerable populations such as infants. We at Knowledge Universe have recently instituted a policy requiring staff to be vaccinated for measles and have restricted access to our infant rooms to individuals who have been vaccinated and parents only. We have instituted this policy in 39 states in which we operate and the District of Columbia. We believe SB 792 will go a long way in protecting infants who are too young to be vaccinated from contracting vaccine-preventable diseases, including measles, influenza, and pertussis. We urge you to pass this important legislation.
Thank you. Please state your name and position.
Sure. Chair and member Sean South with the California Primary Care Association. On behalf of the 2 million children we serve each year, we hope that you'll support this important public health measure. Thank you.
Thank you. Name and position only.
Kat DeBurry with the Health Officers Association of California, the sponsors of this bill. Thank you. We urge your support.
Lydia Bourne, representing the American Academy of Pediatrics. We're in strong support.
Alicia Sanchez, representing the California Medical Association, in support.
Keith Luke is a father of 3 in daycare. I support.
Erica Rohr-Luke, as an executive board member of a parent cooperative nursery school, on behalf of myself, I support.
Angela Blanchard, on behalf of the March of Dimes and Children Now, in support.
Thank you. Opposition?
Eight.
Okay, we're giving proponents 9 minutes, opponents 9 minutes, and anyone else, just please only state your name and position only. Please proceed.
Good afternoon. My name is Victoria Gertschreider. I'm legal counsel for the California Coalition for Health Choice. The 1986 National Childhood Vaccine Injury Act, combined with the Supreme Court holdings of 2011 of Bruce versus Wyeth, the United States Supreme Court found vaccines to be so unavoidably unsafe that the risk of harm to human life was so inherent that vaccine manufacturers would be forever shielded from all liability of harm in any federal or state court in a claim for damages caused by their products. This result has left vaccine safety by manufacturers unchecked and without any incentive to improve on their science or effectiveness to prevent harm. Justice Sotomayor, in the dissent, stated it best that the majority's finding left a regulatory vacuum in which no one ensures that vaccine manufacturers adequately take account of scientific and technological advances when designing or distributing their products. Although manufacturers of vaccines and the physicians administering are shielded from vaccine injury liability, employers implementing a state mandate, such as the one suggested in 792, will not be shielded. California Labor Code places employers liable for the compensation of any injury sustained by his or her employees arising out of and in the course of employment, and for the death of any employee and the injury approximately causes death. There is extensive case law throughout California showing this precedent in workman's compensation, where the claimant was able to sue his employer to recover for damages. Herewith lies the problem today. Employer liability for the large and small child care facilities throughout the state, but especially the little mom and pop shop facilities, a state mandate like 792 would require their employees to receive all vaccines at the direction of their employer. And that could bankrupt a facility after just one adverse reaction. Additionally, California, every employer has a legal obligation to provide and maintain a safe and healthful workplace according to the California Occupational Safety and Health Act, Cal-OSHA of 1973. Because there is an occupational injury or illness risk from the forced injection of intrinsically unsafe vaccines, as found by the Supreme Court, into the bodies of daycare facility staff, it is required that this bill have the intimate review and involvement of OSHA, Cal-OSHA, and its counsel, especially when given the blanket statement in the bill that the schedule and routine adult immunizations would be followed by the Federal Centers for Disease Control and Prevention. That is the only guideline. It could be expanded at any time by CDC. Because there is this risk, there needs to be, and we don't see any evidence in this bill analysis nor in the bill itself of any reviewer input vetted by Cal-OSHA to determine its effect on the health and safety employees in the state of California, nor the resulting obligation of employers. The people of California request that this committee have an analysis be performed by Cal-OSHA before a vote is done on this bill.
Just hold on for just a second, and I'm going to stop your time, so I won't take any of your time. What I would have appreciated if you guys would have done is if you would have given us a letter ahead of time to put in our analysis. It's very difficult to analyze something that you have a concern with and hear it for the first time. So we can't address any of your concerns with regard to Cal-OSHA if we didn't have that ahead of time.
Okay.
So please proceed. None of your time was taken away.
Thank you, Senator. If the lack of safety analysis and liability ramifications were not enough, child care facilities already find themselves riddled with very high turnover rates, ranging from 30% to 65%, almost 10 times that of school teachers, in being able to maintain safe and competent staff. By creating this mandate, not only would child care facilities be left with the full financial burden for damages, but also would be further limited in finding already scarce supply of workers. There are inherently individuals in this field who will have family history of reaction or other unrecognized permanent medical needs that may make it difficult for them to receive a medical exemption. By passing this bill, this legislature will be endangering the field of childcare, which is already at a risky and scarce level. Due to the above reasons, we request that small in-home daycare facilities at minimum be excluded from the language of this enforcement of this bill. It is a huge financial burden that the state is clearly not taking over on behalf of the childcare facilities. Safe and qualified childcare facilities are already difficult for parents to find. By adding the increased risk of liability of harm, OSHA reporting and penalties requirements, joined with the increased lack of qualified and safe ratios of employees mandated by the state, will result in leaving many of these small businesses insolvent due to the increased coverage costs and possible unavailability of required liability insurance that childcare facilities must have. So lastly is the issue of lack of religious exemption options for employees, and that occurred in the amendment that just recently was done, because they were there before. It has been found repeatedly that employees are protected in their religious beliefs and being allowed to obtain employment. This was found in Title VII of the Federal Civil Rights Act. Moreover, widespread hospital policies and the American Medical Association's Code of Ethics allow religious exemptions in support of the contention that healthcare facilities can reasonably accommodate employees' religious objections. Even the Equal Employment Opportunity Commission, a federal agency that enforces anti-discrimination laws and investigates employer discrimination complaints, also supports their employees' right to refuse vaccines in the workplace. Most importantly, California's Fair Employment Housing Act, FEHA, also protects California employees from discrimination based on religion. So we ask that a religious exemption be allowed in an amendment.
Thank you. State your name and position. We have under 3 minutes left for the remainder of the testimony.
Hi, my name is Priscilla Cifuentes. I'm from Whittier, California, and I'm a constituent of District 32 with Senator Mendoza. I'm also a child care worker. SB 792 would mandate that I be fully vaccinated following the CDC's adult immunization schedule, only allowing medical exemptions. This would discriminate against my religious beliefs, as I would not be eligible for employment unless I meet the requirement. As a female in the field and in childbearing age, it is concerning to me that vaccines are a Class C drug. The Tdap and the flu shot are recommended during pregnancy. This bill would mandate, per the vaccine manufacturer's own insert, not a single vaccine has been tested for safety on pregnant women. They don't know what vaccines can do to the unborn baby. If I become pregnant in the near future, I will not be able to keep my job with fear of safety of my unborn baby and my religious objections. SB 72 would discriminate against me. I have a list of ingredients here that I would pass out for you. I want to note that in 1986, Proposition 65, was passed. This requires that any carcinogens being used in products, if they're using the carcinogenic products, the businesses must notify Californians. Proposition 65 enables Californians to make informed decisions about protecting themselves from exposure to these chemicals. Formaldehyde is a known carcinogen and is a common ingredient used in many of these vaccines. As a child care worker in California, Proposition 65 entitles me to make informed decisions about protecting myself from exposure to these chemicals. And I do have a list for you. Just let me know when you guys want me to pass them out to you. Thank you.
Thank you. State your name and position, please.